Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture and Chiropractic Clinic. This has to do with self-assessment of your joints, specifically the shoulder joint, which is what I'm going to talk about. So stay tuned. All right, let's talk about some of the things that I'm presented at the office. I just wanted to clarify this. I think it's so important for everyone to be equipped with the knowledge so they can assess themselves better. So when you have, let's talk about the shoulder joint. Let's find out if I have pain in my shoulder joint, is it in a specific movement or is it in all movements? If it's in all movements, and I'm doing it versus someone else doing it, there are different structures that we're talking about. So if it's pain in all ranges of movement, more than likely it's a bursa, not tendon. Don't use the terms incorrectly. Bursa is like a cushion. So if I can move it in every direction and it hurts, maybe some areas more than others, in active and passive, that's more than likely a bursa. More than likely, there's always an exception. Tendinitis has to do with an inflammation of the tendon itself, which means a specific muscle, a tendon of a muscle. So that specific muscle engagement can cause pain. And then I may think about tendinitis. So now you want to see, do you have pain? Let's talk about your biceps here. So let's say I have pain right here and I don't know what it is. So I'm going to grab this weight. So right there, if I hold it and it's pulling the weight down, do I have pain in the shoulder joint? If it's tendinitis, I shouldn't, because it's not engaged. So then if it's at the beginning versus middle versus end, it tells me what part of that muscle is engaged. Is it the tendon at this end or that end, or is it the belly of the muscle? All of those make a huge difference. So pay closer attention. It really sucks when patients come and I say, well, tell me more, and they can't even describe it because they didn't pay attention. Pay attention. Every little detail, honestly, gives us an opportunity, us the doctors, to those who take the time to listen, to see exactly where the issue is. You're giving us the details of a picture that is your story. So in order to help you, you need to give me more information, so hopefully I'm listening and not wondering, when is this going to be over? So then we can figure out what's going on. So pain at the initiation of a movement, mid-range or end range, they all mean different things. Pay attention to it. The nature of your pain is important. I've done a whole blog on that very subject. We'll make sure that we put the blog information here. So from the nature of your pain, if it's dull versus sharp versus tingly, pins and needles, they all mean certain things, but then again, more than likely, it's never 100%. I wish I could make it black and white, but it doesn't work that way. Anyway, I hope you're getting value from these videos, and I invite you to subscribe to the channel and share it with your loved ones. I also have a podcast you may want to explore. It's called Life and Health Matters with Dr. Shakib, and it's on all the major podcast platforms that are out there, Spotify, Apple, and Google, and whatever else is there. Anyway, thanks for watching. Take care.